Claim denied. Patient coverage is terminated. Claim adjustment reason code 26 and 27. A medical biller encounters a situation where a claim has been denied because the patient's coverage was terminated or the policy was termed by the insurance company. There could be a number of reasons. The patient's premium payments have not been received. The patient has exceeded their lifetime coverage limit. The patient has changed insurance providers. The patient is no longer eligible for coverage. Claim denied is member coverage terminated or policy termed. Request denial date to understand when the claim was denied. Request policy information, policy's effective date, when it started, and the term date, when it ended. Check date of service, DOS, if the date of service, DOS, falls between the effective and term date of the policy. Scenario A, DOS inside policy period. If the DOS falls within the policy period, claim will be processed. Inquire about the turnaround time, TAT, for the reprocessing. Make sure to take the claim number, claim hashtag, and call reference number, call ref hashtag, related to the denied claim. If there is no coverage and if the patient is unable to afford to pay for the services, you may be able to work with them to set up a payment plan. You may also be able to offer them financial assistance programs. Scenario B, DOS outside policy period. If the DOS does not fall within the policy period, inquire if there is any other policy that is active for the patient on the date of service, DOS. If there is another active policy, update the new policy ID and resubmits the claim accordingly. If there is no other active policy on the date of service, DOS. Release the claim to the patient since there are no active policies covering the date of service, DOS. If other insurance is available, check the eligibility for that insurance on the web portal. If the patient is active for that insurance as primary, the biller makes it primary and resubmits the claim. If there is no active policy and no other insurance available, the biller can release the claim to the patient. However, should first check for the availability of any other insurance options. If available, they should assess eligibility and potentially resubmit the claim. Always ensure thorough checking of previous DOS and eligibility before resubmitting the claim if payments were received from another insurance. Here are some tips for dealing with a claim denial due to patient coverage being terminated. Be prompt in responding to the denial notice. Contact the patient immediately to inform them of the denial and to discuss their options. Be sensitive to the patient's financial situation. Offer the patient financial assistance options if available. Be polite and professional when communicating with the patient and the insurance company. Document all conversations and correspondence related to the claim.